Just got a few more people joining. But if you would like to make a start, Jan, then we can keep to our schedule.
Yeah, okay. Okay, well, hello and welcome to everyone to this opening session of the National Pensions Convention 2022 Annual Convention. This is a special interactive webinar, and it's about an issue which is vitally important to us all. That's the new Health and Care Act and what it means for our local NHS services, and most importantly for you and your families. So I'm delighted to welcome as our guest speakers today. Now, unfortunately, Sharon Graham, the General Secretary of Unite, has been called to an urgent meeting this morning, but stepping up to the plate in Sharon's place is her senior advisor, Simon Cox. Simon has been lead researcher on a number of high-profile campaigns for Unite, and they represent 100,000 health workers. And I would also like to welcome Dr. Tony O'Sullivan, who is co-chair of the Keep Our NHS Public Campaign Group and as part of the SOS NHS, and has campaigned tirelessly against the new Health and Care Act. First, though, I'd like to introduce Jonathan Safier, our National Administration and Information Manager, and he will explain the format for today. So, okay, Jonathan?
Hi, everyone. So welcome to the interactive webinar. We will have an introduction from Jan, followed by our presentations from our two speakers. Just a couple of housekeeping rules before we begin. You'll notice that you're all on mute. You will be kept on mute until we go to a breakout room. So after we've heard from our speakers, there will be 4 breakout rooms. After we've heard from our speakers, I will actually show on screen how we go into breakout rooms so that there's no confusion or anything. And once you've been in your little groups, we will then have feedback from the chairs and continue on with the webinar. If you have any questions, please put them into the chat. We'll try to get them answered during this webinar, but if we can't, we will try and endeavour to get them answered after the webinar as well. So please be respectful throughout. This is a meeting of people may have differing views and comments, and once you're in the breakout rooms, you will be unmuted, so there will be a chance for discussion. So please, everyone, be respectful of each other. And as I said, we'll get back to Jan now, and she'll give a brief introduction, and then we'll hear from our speakers. Thank you.
Okay, thank you, Jonathan. And if anyone's got any issues, please post them in the chat. We'll try and help you out wherever we can. We know that, the gremlins usually have quite a party. So the controversial new Health and Care Bill was finally pushed through the House of Commons into law in April. And this was in spite of the best efforts of peers in the House of Lords and campaigns by the NPC, Keep Our NHS Public, We Own It, trade unions like Unite, to halt and amend what we view as legislation that will badly impact on the struggling NHS. Despite the government's insistence, the new Act is not going to help fix the sector's huge problems, such as overstretched services, overworked and underpaid staff, and longer waiting lists for appointments and hospital treatment. It will also, through the new local management structure of 42 integrated care system boards, as we call them ICSBs, significantly reduce the accountability of NHS health providers and contractors. An increasing proportion of providers are private businesses and overseas private equity companies. This new Act will make it easier for them to influence how NHS contracts are distributed and managed, and weaken the accountability of local people and elected councils to scrutinise the standard and quality of services they deliver for public money. The new Act also gives the Secretary of State for Health extensive new powers to direct the work of NHS England and intervene on decisions over changes to local services, including the ability to deregulate individual ICSBs if he or she disagrees with it. In this webinar, we aim to explain the full implications of the Act and discuss the issues for patients and hard-pressed health workers, including concerns over the increasing privatisation of services. And most importantly, we will discuss how you, as ordinary members of the public, can campaign to save our much valued local NHS and care services, and particularly to influence the composition and accountability of the new ISC boards. We've often said before, we may have lost the battle to see this damaging act come into law, but we have not yet lost the war. Now, I would like to introduce Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public. Now, Tony is a retired consultant community paediatrician, and he is also vice chair of Health Campaigns Together. Tony, could you please outline what the changes are that are being introduced by the new Act and what they actually mean? So, good morning, Tony.
Good morning, and thank you very much to National Pensions Convention for inviting me to speak. I've got some slides which I was advised you might welcome, and you can share them afterwards. So I'm going to put those up now, if that's okay, hoping this works well, and tell me, Jonathan, if it doesn't. Hopefully that's okay.
Yep, we can see those. Great.
So as Jan's just introduced, and very succinctly and well, thank you, I was going to talk about a little bit about Keep Our NHS Public. That was asked of me. What we are saying about the Health and Care Act now that it's passed, and why we opposed it, and then a little bit about what we can do in the future. The Keep Our NHS Public was set up in 2005. Now, the interesting thing is that was during the Tony Blair period of government, and it was set up to oppose privatisation and to uphold the founding principles of the NHS from 1948. At the time in 2005, we were opposing the extension of private finance initiative for building new hospitals and the use by the Labour government then of independent sector treatment centres for addressing a section of the waiting list rather than investing further in the public NHS. And since then, of course, we've continued to oppose the purchaser-provider internal market in the NHS, which was a preparation for the open market, the competitive tendering of services that was let loose by the Health and Social Care Act in 2012. And we've opposed the outsourcing of services and staff from the NHS to private companies, and indeed the setting up of private company wholly owned subsidiaries by NHS trusts. And our work over the last 15 years has included toxifying, more recently, conservative privatisation policies, especially up to 2019 when they were denying they were privatising the NHS. And the worrying thing now, since 2019 and the large Tory majority and the confidence that they have, they no longer deny that. They say only dinosaurs deny the great value of a partnership of private sector involvement in the NHS, which is a lie and is parasitising the NHS. We've also fought against hospital closures, and we've saved 10 hospitals, including my own in Lewisham, and that represents saving 4,000 to 5,000 hospital beds, which would have added to the disaster of COVID if those hospitals had closed. And we've still now constantly opposing cuts, mergers, rationing of healthcare, selling off of NHS estates. And through the looking at what's happened to the 2 million undocumented people in this country and the denial of healthcare to them, in hospitals apart from emergency care. That's actually ending the principle of universal care. And so that aspect of racism and damaging to the NHS is something that we're opposed to as well. And alongside the NPC, we have more recently set up a campaign group, National Care Support and Independent Living Service, calling for an end to social care disgrace. You probably are aware, or many of you will be, that last year we set up the People's COVID Inquiry, and that was in the absence, the refusal of the government to call a public inquiry. And you now know that there is a national public inquiry, but it won't be meeting in public until probably Easter next year. And the findings from it will definitely not be available until after the next general election. So our People's COVID Inquiry was an important collection of evidence. We are campaigning for the NHS in different areas, but a really important area is primary care and GPs. And so many of us are finding it difficult to access GP care now. And there was a very interesting program on Panorama exposing the Centene operative in the UK operas and their takeover of GP services. More of that later. And a big issue now that's coming up more and more as important is the exploitation of NHS patient data. At a patient level, our own personal data is in danger of being handed over to private companies to exploit at scale. And it's incredibly valuable in ways that I had not really understood until recently. And the huge contracts are likely to be given to Palantir and faculty, who was part of the Cambridge Analytica scandal. And so that's something for us to keep our eye on. So those are a lot of the areas of work that we are, sorry, for some reason my, oh yeah, moving on now. Right, so the Health and Care Act passed on the 28th of April, as Jan said. One of the things that about it is that it had nothing to say about the fundamental issues facing the NHS and the people that use it. Nothing to say about the funding crisis, nothing to say about the crisis in NHS and care workforce, the dangerous staffing levels, the pay and conditions, and the very, very dangerous morale that's seeing tens of thousands of people leaving those services. It had nothing to say about growing patient waiting lists, now 6 million, and it had nothing to, well, it had something, it was pretending to reduce privatization, but it did nothing of the kind. It's actually opening the way to further privatization. And for some reason, it's not moving on. All right, sorry, but apologies about that. There are some specific dangers from the Health and Care Act, which I'm going to say, and Jan's already referred to some of those, but they're worthy of discussion later on. The Act breaks the NHS up into 42 separate integrated care systems. And one of the fundamental aspects of that is that they are being given financial responsibility and duties to cap their budgets in their own area and to, in a way, mimic 42 separate organizations. And one of the ways they're going to do that is the setting of local costs of healthcare, which may lead to increased rationing. And it may even lead to the breaking of national terms and conditions for staff as local integrated care boards attempt to balance the books and reduce the cost of care. So we're likely to see a worsening of postcode lottery, which people up and down the country are already suffering. The Integrated Care Board and the Act did not nail down what level of accountability and democratic involvement there was going to be, and it's left that very much to local integrated care systems to set up. And there's a real danger that these huge integrated care systems that are responsible for about 2 million people will lose the democratic involvement and scrutiny of local scrutiny committees and public. So that's something to be aware of. The Secretary of State has now assumed lots of new powers, but two of them I want to mention. One is the Secretary of State's ability to impose his will, it's a him at the moment, on local reconfiguration. And they could overturn or circumvent local consultation, for example, on the closure of a hospital or a merger of service, and just say this will happen now. And that's a very dangerous reduction in local democratic involvement. And the other thing is that they have given the Secretary of State the right to deregulate professional staff in the NHS, so that professional regulation would no longer exist for some staff groups. And that would mean that they can start to de-skill sections of the NHS workforce. And we've seen that with the dangers of that with OPROs. Jan asked if I could just mention that a little bit more. Now, OPROs is the Centene wing of the company in this country, and they are now the biggest provider of primary care for 600,000 patients in this country. So it's a profit-taking shareholding company. They were subject to a campaign that Keep Our NHS Public and others campaigned against from last year through to the beginning of this year, where we tried to say that the handing over of that contract was wrong and had no scrutiny and did not face the risks of a private company taking over. What they've done is they now run their surgeries with literally half the number of GPs compared to the average around the country. And they have replaced them with physician associates. So these are associates who are not doctors. They have 2 years training. No doubt many of them are good, but what they fundamentally need is medical supervision from GPs in their practice. And the Panorama program exposed that OPROs had cheapened the costs of their delivery of service by replacing GPs with physician associates, and the physician associates were not getting supervision from their GPs. And in many cases, there was no GP on the premises of a practice throughout the whole day. And there were a further scandal was that tens of thousands of items of hospital reports, clinical letters, and investigations were being sorted by non-clinical staff or physician associates without the reference to a GP. And that is not only is that dangerous in itself, but there were 3 to 6 months delay in sorting that out. So there may be letters there of people with cancer or investigations that need to be followed up. So for me, that's a really good example of the dangers of deprofessionalizing the health service. And of course, the care service has already been deprofessionalized in many ways, and that's a demand for the future. Two other things to mention, because that's taken a little bit of extra time, is the dangers are that the Act now allows hospitals to discharge to assess, so discharging patients without a care plan in place. And the justification, which is a lie, the justification is that community care will look after those patients in the community, in their home or wherever they're going to. Now, we know that community care is in tatters. It's under just as much stress as hospitals, as A&Es, as ambulances. So that is a dangerous development. And finally, a lot of people do not know this, and the government were told it but refused to recognise it. The duty of integrated care boards to provide emergency care in their area for all, not only the residents, but people working in that area and passing through, travelling, for example, is not guaranteed in the Act. And my worry is that raises a scenario of one hospital or one integrated care board telling hospitals not to treat patients from out of area. And that is not fanciful, because that's already happened. There's an example in Oldham where a retired nurse got a serious burn, And the Oldham department told her she should go to her hospital of residence in Rochdale, and then Rochdale hospital said, no, we don't deal with this kind of injury. You have to go back to Oldham. And she was hours and hours now sitting on a pavement without treatment. Now, that was before the Act. And this failure to guarantee emergency care is very worrying. So after the Act, what do we do next? Can I just say one thing, that I feel it's really important what political message we put out there. I feel we have to say the NHS has not been lost. The majority of clinical services are still provided by the NHS, and we must continue the battle to save it. And we campaign to repair the NHS and return it to a nationally coordinated and wholly public service. The main battles that we've campaigned on around health and care before the Act still remain very cogent and urgent after the 1st of July. For a start, COVID continues, and it absolutely continues with lethality. There's 30 to 40 deaths a day at the moment. COVID is rising again. Hospital admissions have gone up by over 1,000 a week, and nearly 200,000 people have now died from COVID. So we still have the pandemic amongst us, with new variants cropping up. The overall crisis of funding and workforce remains the same. We demand emergency funding. There's insufficient beds, insufficient operating theatres, equipment, roofs leaking, and staff exhausted, low morale, no pay justice, and huge vacancies. Rampant privatisation. The outsourcing of waiting lists is now built in as government policy. They've given a contract of £10 billion to private hospitals to deal with NHS waiting lists over the next 4 years. And they're still outsourcing whole NHS staff groups and clinical support services such as pathology. And social care and the treatment of disabled people remains a disgrace, something to address. Right through the whole system, GP surgeries, primary care is in crisis. We've got something like 1,700 fewer doctors over the last couple of years, whereas the government is claiming more GPs. And there's a right-wing attack from the Daily Mail on GPs. So our duty is to defend primary care as a pillar of the NHS and put the attack where it's due at the government. And of course, there's a crisis in mental health. There's a huge crisis that people don't talk about very much in dental care. 50% of children now have no access to an NHS dentist. There's the loss of universal care, and there's the selling off of personal data, which I mentioned. There's a whole cascade now with not enough hospital capacity, not enough beds, the social care setting, and patients in hospital not being able to be safely discharged to the community, to their own homes or to care homes, because there's no ability to look after them. And that block in the system means that there's serious delays of patients in A&E being admitted to a hospital bed and starting treatment. And there's a delay, therefore, in ambulances being able to transfer their patients from ambulances in the car parks into A&E. And therefore, ambulances are stuck in queues and are unable to respond to new emergencies. And that's not the ambulance's fault, and it's not the ambulance services' fault, it's the government's fault. So people are dying at every step of that way now. And in the background, there's the long waiting list for first appointments and treatments, 6.4 million and rising. What Keep Our NHS Public is saying with others about how we can intervene at the local level, I think it is important to look at, because there are those general campaign issues, but there are also ways to try to defend as much as we can about at the local integrated care board, integrated care system level. We need to be demanding of them that they can continue to provide a comprehensive health service and oppose rationing. We need to stop them having private representation on their boards and their subcommittees. And we've already, with We Own It, launched a campaign of letter writing to boards, and 10 boards have replied to say, 10 chairs of boards have replied to say that they intend not to have private representation. That needs to be followed up, of course, for them to be held to. We need to be demanding that NHS is the default provider of services. And I would say that also should be the case for things like controlling data. There is no reason why the NHS, which is one of the largest employers in the world, should not be in control of its own data and its own data systems. We need to ask them to guarantee access to emergency care for everybody in their area, even if they're passing through, and importantly, even if they're undocumented or migrants. We need to demand the democratic accountability and representation at these board meetings, and the right of the public to attend, to see the papers of the meetings, to ask questions and receive answers. It was bad enough under CCG days, but we need to fight that it doesn't even get worse, especially with these huge 2 million people population conglomerates of integrated care boards now. We need to demand the safe discharge of patients and stop that dumping of patients if that starts to become a trend. And of course, we need to be prepared to support union demands to defend national pay terms and conditions and professional regulation. That will obviously be led by unions, but campaigners should be aware of those risks. In the longer term, of course, we need to be demanding the putting back together again of the NHS, and legislation will be needed such that we were supporting in previous times with the NHS reinstatement bill. We need to resurrect that and ask of incoming opposition parties, whether they're the Labour Party or a coalition, that they reinstate the NHS. Jan was asking how can NPC and Keep NHS Public work together, and at national level, I would propose that it might be worth at least a one-off meeting where we have a discussion how we could best work together, because actually we've worked very well, but we haven't had that conversation, and I think that might be worth the value of an hour's session, at least a one-off. I would thank Jan Short herself for giving excellent testimony at our People's COVID inquiry last year, and I've put the link there for people to take away if they want to revisit that, to hear her in the video and to see the report. And the convention also sponsors the SOS NHS Alliance that was supported by, set up by Keep NHS Public and Health Campaigns Together, which is our trade union facing campaign. And Unite itself is one of the 50 sponsors along with the NPC. And I think this was only set up in November and is a potentially valuable step forward. NPC also hopefully will continue to support the campaign for a national care support and independent living service, which is an alliance of similar-minded organisations. Nearly finishing now, but on a local level, we have 70 branches around the country, and we already work with members of NPC who are often members of Keep NHS Public, of course, but maybe we could discuss how that might work even better. And we work together with Unite community branches around the country and other organisations. I think it's important that we share information that we can use locally in our campaigning as well as nationally. Our report, the misconduct in public office, attacking the government's culpability and its lying, is available in full report, in executive summary, and indeed all the original videos. And we thank the NPC for your excellent Goodbye Cinderella report last year. There are smaller level actions that for local involvement, the petitions and letter writing tools. We're handing in a petition of 383,000 to demand the re-availability of free COVID testing and support for isolation for COVID. And I've got a Keep NHS Public rebuild our NHS petition there. And we own its letter writing tool and our own model letters for writing to MPs, to local chairs and local councils. Those are useful also, so you may want to take avail of those. Coming up at actions, we've got the TUC demonstration on Saturday, the 18th of June, this Saturday, and we've got an SOS NHS block. So if you need somewhere to march with, we would love to see lots of people on that health block. And of course, we're saying health and care in all our work. And on 2nd of July, there's the 74th birthday of the NHS, which is 3 days later, and the National Day of Action in support of the NHS in crisis. So you may be interested in local involvement there. And in October, it would be very good if Jan were able to speak there, but the SOS NHS conference, which we're planning, we haven't got the final date yet. And please do receive our newsletter. We've doubled our mailing list in the last 3 or 4 weeks, and we would love you all to at least have the information that we're providing. A new book is now out from John Lister, whom you all know, I think, and Jackie Davis, NHS Under Siege, The Fight to Save It in the Age of COVID. And there is a 20% discount if you get to Merlin and use the NHS 1948 code up to the 17th of July. And these are the leaflets that we're putting out on Saturday. The SOS NHS one, we're demanding emergency funding, pay justice for health and care staff, and money to go to a publicly owned and run service and not to the private sector. And our Keep Our NHS Public, rebuild the NHS, no more needless suffering. So I'm looking forward to ongoing and richer work with the NPC. Thank you very much.
Thank you, Tony. That was really, really interesting. It's scary, but it has to be said. I'm quite surprised I haven't got any questions, but I'm sure there'll be lots after the breakout rooms because people want to, maybe listen to a bit more. We will certainly continue to support everything that you do, and I'd be honoured if I could speak at the SOS NHS conference. Hopefully, if you get a date fairly soon and let me know, we can put that in. So I think the only thing I'd want to say is it's quite very clear to me, and I don't know how people listening and watching in feel. I actually feel that the universal NHS service that was set up by Nara Bevan in 1948 is being dismantled, and I think that's quite clear now. And as you say, we continue to fight because there is no other option not to. It's either do that or we all end up in an American style health service where those that can pay can be treated and feel well, and those that can't will get a very, 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 very basic service which won't help them to live healthy lives. Okay, so thank you, Tony. We'll look forward to seeing you after the breakout. Okay, right, okay. Now I'm going to introduce you to Simon Cox, who's a senior advisor to the General Secretary of Unite, Sharon Graham. Now Unite, as we all know, is one of the UK's largest trade unions, and it represents 100,000 people working in the health and care sectors. And it's always been opposed to the health and care bill. Their union members in England have huge concerns about its impact on services, the accountability, the funding, the professional standards, the privatisation, safety, and terms and conditions. Now, we all know the COVID-19 pandemic has been one of the biggest crises that the NHS has ever faced. And it was made worse by 10 years of underfunding, understaffing, and privatisation that left the service in a critical condition. Change is urgently needed, but Unite agree that this act is the wrong prescription for the English NHS. And I'm delighted to introduce Simon. He's a senior advisor to Sharon, the General Secretary of Unite, and Sharon and I will be addressing the National TUC rally in March to Parliament this Saturday on the 18th of June. It's part of the We Demand Better campaign, movement which flags up the whole range of problems facing people in the UK at present. So we are pleased to have Simon here, especially since he only stepped up late yesterday afternoon. So before he became Sharon's senior advisor, he worked with her in the National Organising and Leverage Department as a lead researcher, working on many campaigns, including the campaign to prevent the US-EU trade deal, which we used to call TTIP, from including provisions from the privatised the NHS. And NPC was at the forefront of that many years before it became an issue and often accused of scaremongering, but we were so pleased to be proved right by Simon and Sharon, who gave a critical speech at one of our pensioners' parliaments in Blackpool. So that's where we started our relationship. Yeah, so welcome, Simon. So I think you're going to tell us what the problems are for Unite with the new Act and the pressures on the staff and membership that you actually represent. So
thank you very much, Jan. Hello, all of you. I just want to start by saying Sharon's really sorry that she can't attend. She did have an urgent issue, a meeting around an industrial dispute that she had to go to, but she sends her best wishes and her solidarity to you all. As Jan knows, Sharon has an awful lot of respect for the NPC, and I know that she's hoping that we can work together more closely in future. I also should say I have a strong personal interest in the NHS, not just because they, in the last few years, saved the lives of both my parents, but also because my wife is a doctor and my two best friends are a nurse and a speech and language therapist, both working in the NHS. So it means a lot to me. But I also have a professional interest because the NHS is not just a precious asset for all our members, it is also a very big employer of Unite members. As Jan said, health is the biggest industrial sector in Unite. We've got over 100,000 members working in the sector. We are one of the 13 trade unions officially in the NHS, and we represent workers throughout the NHS. We're particularly strong in some areas such as community health visitors, speech and language therapists. We're working on estates, some pockets of acute nursing, but we have a broad spread of membership within the NHS, including GPs. And as many of you will know, NHS England is the country's biggest employer. It's the NHS is the third largest employer in the world after the US Department of Defense, the Red Army in China, Walmart and McDonald's, with well over 1.5 million people there. And it's worth remembering that only 36% of the staff in the NHS are actually doctors and nurses. There are an awful lot of other people that are required in order to make sure that that you get the care that you need. And all of these NHS workers, pretty much across the board, are coming out of the pandemic, squeezed by years of underfunding, and are very much not happy. There is a really vicious circle going on at the moment of understaffing and overwork, leading to stress. So more people are leaving, fewer people are joining, and then that's more understaffing, which means more stress, more overwork, and it carries on. And all of that is also very much fed by the suppression of pay and terms and conditions in the NHS, where it's been squeezed for many years, and every tiny thing that can be cut is being cut. So this is a real crisis, a real disaster. It means that it's much harder for NHS workers to provide the levels of care that our members and you all want to have, and that they want to provide, and that the country deserves. So obviously it makes me rather sad to then have to tell you about the Health and Care Act, which received royal assent in April and is going to come into effect on the 1st of July, because that act is almost certainly going to make things worse rather than better. Now, as Tony has already outlaid in detail, the main thrust of the Act is to break NHS England, the NHS in England, into 42 local integrated care systems run by integrated care boards, and they're based on kind of business models. And on the surface, in the propaganda, this is all aimed at integrating health and social care, but underneath it's really threatening to further run down the NHS and bring in more privatisation via the back door. But even before I go into that, I just want you to think about the amount of time and effort and money that an overstretched NHS will now have to put into restructuring itself. The vast sums of money being spent on management consultants, key staff being called away from other work. All of these are resources that could be put into overcoming staffing crisis and improving patient care, cutting waiting lists. We've got also a lot of confusion and distraction that's therefore caused by this massive restructuring. We've got people going for, at the moment, Unite, dealing with the transfer of staff from NHS Improvement to NHS England, Healthcare Education England, and NHS Digitisation going into NHS England, NHS England staff going to our ICBs. All of that is taking time, effort, focus, and money away from the NHS core tasks in crisis. And things like the possibility of discharge for patients without a care plan, which has been mentioned, which will obviously not only endanger their potential management and safety, but then also create a more of a burden on staff in the longer term, trying to fill the gaps. And those gaps and failures in the NHS also are creating opportunities for the private sector. And I mean, I think that's pretty deliberate. The NHS, as has been said, is being run down. And as that's happening, those who can afford it are increasingly using private sector services. So it's beneficial for them in that respect. And they're also taking over and often running on a shoestring NHS services. You've already heard about the possibility for private companies to now become NHS decision makers in these new integrated care boards by putting their own people onto those boards if they, where they're allowed to, and certainly the legislation allows for it. And we are always concerned about more of these so-called alternative provider medical services, basically private firms cherry picking. So they get the easy, more profitable, quick turnaround cases, and then undermine working practices, and then create a threat to the staff which remain in the real NHS services, who are then more overloaded, more overworked, as they have to deal with the hard, expensive cases that the private companies don't want to take. And that's a serious threat. As Tony mentioned, there's also a real concern about the powers that are being taken by the Secretary of State for Health as a result of this legislation. More power to interfere, imposing decisions from government onto local issues like hospital closures, and undermining the role of local authorities and local people in the way that the health services are run in their area, in opposition to the way that the propaganda has been going. This is also a real concern that the ICBs are going to have to operate to their own budgets and with their own targets, which, as we know, means basically that they're going to be pushed to tighten the purse strings, as is always happening, and that will then be a threat to potentially to collective bargaining from our point of view as well, because although we have got, and I should say this, we have got some reassurances from NHS England that the ICBs are going to be they're now in the annex of the terms and conditions of service handbook, so that they will have to, initially they are going to be abiding by national collective bargaining. There's always this threat lurking in the background that they might start to try and break away from that, or just ignore agreements, undermine it. We've had for many years people being put on to doing work that are which is much higher than the grade that they are being given for pay, because it saves money for the for the trust to kind of give work beyond the grade of the people doing it, and that's also a recurrent threat. But perhaps even more of a worry, and this was also already raised by Tony, is the issue of professional regulations on standards and training. So the health secretary will now be able to impose decisions about professional regulations on standards and training of NHS staff. And the Health Education England, which was responsible for oversight of NHS training, has lost its independence, is going to be moved over to NHS England. So we're really concerned that the possibility of deregulating NHS roles in future, which would allow private companies and others to lower standards, and then create more opportunities for private companies. And again, the possibility of new technology being used here to replace people, in a way which isn't properly regulated. So there's a serious danger there. And so overall, we've got an NHS that really is in crisis, and we have an act that isn't going to help. But as Tony said, there is a possibility to fight back on all of this. It's clear that this restructuring of the NHS isn't fit for purpose, and as has been said, we need a universal, comprehensive, publicly provided NHS which is properly funded and free at the point of use and fit for the 21st century. And we're quite a way off that at the moment, but we shouldn't throw our hands up in the air and give up. There are battles to be fought at the national political level as well as at local level. Sharon is looking at how to revitalise our work with Unite's retired members and community members on local issues, and she's very keen to work with the NPC on that. And I know she's spoken to Jan about that already. So we can look at things like, what's going on with the boards of the ICBs in your area, who's getting on there. Tony's already flagged up the possibility of lobbying the chairs of those boards to try and stop any private companies getting on there. You can look at what private companies are already operating or trying to get into your area. You can look at the budgets that your ICBs are going to get and the targets, and whether that is going to create a crunch, which is a threat to the health of the people in the area you live in. And of course, we can all keep an eye out on what the Secretary of State for Health is doing with these new powers, especially any lowering of professional regulations and standards. So those, I think, are it's an overview of the concerns that our members have regarding this act, and I very much look forward to listening to the ideas that you guys come up with in your breakaway rooms to try and push back against that. Thank you.
Thank you, Simon. I do have a question, and I think it's for both yourself and Tony. It comes from Pat Hughes, and she's asking, can someone please explain the structure and accountability lines above the 42 ICBs. Yeah. So who would like to go first?
Do you want to take that, Tony?
Tony?
Sorry, yeah, I'm with you. Sorry.
Yeah.
Well, the truth, as far as I see it, is that these 42 are the smallest number of organizational units as a whole since the beginning of the NHS. So in the past, there were strategic health authorities for large areas, regional health authorities, and local health authorities or local trusts and CCGs. And now that's all been swept up into 42. And as I see it, the next rung up from that is NHS England and the Secretary of State's direct hand on it. So the accountability is very directly politically controlled. And of course, on the one hand, we want a government that's accountable to the population at elections to be responsible for public services. But when we have such a right-wing government intent on breaking up public services, defunding it and having it there to be parasitized by private sector, then we have a dilemma. But that is my answer to the accountability. It's integrated care boards, NHS England, with all those other bodies now swept up into it, as Simon's just very, very beautifully explained, and then the government.
Anything to add to that, Simon?
No, I think Tony's explained it perfectly. I mean, the ICBs are where the power is, except NHS England and the Secretary of State for Health can then, in particular, can then just impose their will onto them. Yeah. So, but they are decision-making bodies, and that's why it's so dangerous that public companies or so private companies can integrate themselves into these things, because that's basically giving private companies a decision-making position within an organization which has enormous financial power to make contracts and arrangements with those kind of private companies. The conflict of interest is huge.
Right, there's a supplemental question from Pat, and she's saying, so what is the role of NHSE? So that's the next one. Tony, do you want to take that? Do we know what that is?
Well, with the Health and Social Care Act in 2012, NHS England was the supreme commissioning body, and supposedly separate from more separate from Secretary of State's influence. With this new arrangement, then I think it's, in a way, it's what Simon's just said, that there's a huge amount of commissioning strength to make decisions at a local level, with the kind of stick hanging over them that if they don't make financial ends meet, then they have to. So they will have to make cuts in services, or they will have to cheapen the workforce, or they will have to in some way cost save. So for me, NHS England is the overarching commissioner, and it's also taken on professional regulation and all those other things that Simon's just explained. So that is the role, but it's the Secretary of State's taken a lot of control back so that it can influence what NHS England says even more than it's been able to do before.
Yeah, okay. Thank you very much, Tony. I think that makes it quite clear what we're up against. Okay, it's time now for you to have your say. So I'm going to hand over to Jonathan to explain what's going to happen to all of us as we disappear and hopefully come back. Jonathan.
Hi there. So I'll just give a quick explanation, which I've put up on screen. You'll be assigned into one of 4 breakout rooms, and you'll have approximately 15 minutes to have a discussion about a question posed by the chair, who will be Sandra, Christine, Marion, or Bev. You'll be able to unmute yourself and so on once you're in the breakout rooms. But please, for ease of the chair, please either raise your hand to the screen or go to reactions at the bottom of the panel and click raise hand. For those who are on YouTube, we're going to have a quick break because we're not going to put you into a breakout room. And if you bear with me all, I'll just give a quick little rundown of how you get into the breakout room once I've set them up. So once I've assigned you to a breakout room, you'll see something pop up on your screen, which will look like one of these 2 images, hopefully. And if you click on join breakout room, you'll then see the image on the right hand side, and eventually you'll go into the breakout room. After 10 minutes or so, I'll send a little message saying you've got roughly 5 minutes left. And then with a minute to go, you'll see an image like the one at the top, which will give you 60 seconds to return. So if you're still speaking a little bit about your topic, then you've still got a few seconds to have your discussion. At the bottom right of your screen, you'll also see leave breakout room. And if you click on the blue one, you'll return back to the main meeting. If you accidentally click on leave meeting, what you'll need to do is go back to your email and rejoin the meeting.